We're live?
We're live.
You're the director? You should have this. Okay, and welcome to True Health Tuesdays. Today we're going to talk about blood pressure. Now, what's frustrating is what we're going to talk about is how to take it and what the number is. Not the number of drugs that affect it. We're going to talk about one or two of them. But it's kind of weird to think that our species doesn't understand that you're self-regulating and you're self-healing. You actually think blood pressure is a big issue because it is. First, let's look at the function of blood. What does blood do? Okay, well, we know it carries nutrients, it carries oxygen, it eliminates waste products, it balances the pH, it's vital to the immune system. So blood has an actual function. And you figure you rebuild every red blood cell you got in about 120 days. So even the sickest, most toxic blood you got, it's going to be rebuilt. Now let's look at the arteries. Okay, so when we're talking about blood pressure, we're looking at actually what blood is. Now let's look at the vessels that carry that blood to the site of tissue. We've got arteries, okay? Arteries carry it there, veins come back. Now, arteries are different than veins. Has anyone in here, like when you're pregnant, they say, hey, look, lay on your left side but not your right side when you're pregnant? You know why? Huh?
Blood flow.
Exactly, blood flow, because you've got an artery on the left that if you squish it, it tends to resist squishing, and you got a vein on the right that doesn't resist squishing. Okay, so the artery actually has elastic tissue in it and a muscular layer, so the arteries can constrict to increase blood pressure and dilate to decrease blood pressure. So arteries have a function. They also, and this is why when they talk about clogged arteries, they never talk about clogged veins. Okay, now what holds this? What controls blood pressure? And this is something that we've forgotten. Every doctor learns that your body is self-healing and self-regulating. That's it, self-healing, self-regulating. And it lives through the nervous system. And half of the nervous system is called the automatic or autonomic nervous system. And it's in two halves. Now, one half is located at the cranial area and the sacral area. That's called the parasympathetic. It also means rest, digest, and repair. When this is activated, your body starts to initiate tissue repair. It regenerates tissue. And this is a vital function, and it has to be balanced with the sympathetic. Now, the sympathetic nervous system is also called the fight or flight, and that's located in the thoracic area, top of the lumbar. So when one's activated, the other's not. So you can't have both the parasympathetic and sympathetic acting at the same time. One's going to be up, the other's going to be down. Okay, it's kind of like you got muscles on both sides of your hand. If I fire off my flexors, my hand goes like this. I fire off the extensors, my hand goes like this. If I fire them both off, it ain't moving. Okay, does that make sense? So you have to have one active or the other. Now the sympathetic nervous system, when this thing fires off, you're trying to run away from danger. So what happens? Blood pressure goes up, right? Because you need more oxygen to tissue. You need to increase the function of that blood. Now, where does that blood come from? Because it's going to go to the arms and legs so that you can run away from danger. Where does all that blood come from? It comes from the organ systems. So the sympathetic nervous system is going to suppress the parasympathetic and suppress digestion. It's going to suppress tissue repair. It's going to suppress immune system function, all to keep you alive. Okay, does that make sense? Now, what regulates this again? Self-regulating, the nervous system. Yourself. So when they talk about high blood pressure, what part of the system's broken?
The balance.
Nope, not even that. We're going to find out. Let's go on the history. You're close. So let's go way back when they started to first look at this. 1733, Stephen Hales. He would slide tubes up into animals' arteries to measure their pressure. 1896, Rivarocci developed the sphygmomanometer. Now, this is something similar to what we use today. Now, it's called the blood pressure cuff, it's called the blood pressure meter, blood pressure monitor, blood pressure guide. What it is, it's a device that goes around an extremity. Okay, no, not around his head. Okay, so not neck. Okay, we're talking arm or leg. So, and what it does is it tightens up and shuts the blood flow off. And it has a gauge on the other side. And you slowly release this pressure and you measure how much pressure that gauge is putting on it. Okay? Now, 1905, Dr. Nikolai Korotkov developed this new method of utilizing this pressure device. What he found was if you listen distal or a little bit away from the blood pressure device, once the blood pressure is shut off or the blood flow is shut off, you don't hear anything. And when you slowly release that pressure, he started to hear noises. And right when he heard that first noise, he called that systolic. Okay, and then so he wrote down the number on that gauge. And that's what we still do to this day. See, we put enough pressure on the arm to shut off the blood flow. We slowly release it, and as soon as we hear that, bam, we look at that gauge, we write that number down. That's called systolic. Then we're slowly releasing that pressure and watching the gauge go down, and we're still listening. And then all of a sudden, you start to hear it go away, then it stops. Bam, you look at the gauge, you write that number down, that's diastolic. The old joke was all you got to do to lower your blood pressure is find someone hard of hearing. No, seriously, I'm not kidding. Okay, but now the theory is because we can hear that, but we didn't know what it was. And there's a couple of theories because it's still in debate. Cavitation theory, the arterial wall theory, the turbulence theory, transmission of the heart sound theory, water hammer theory. I mean, there's a number of different theories, but that's how we utilize it. Now, I know you're probably thinking, it might take more pressure to crush my arm than it would that of a 10-year-old. Okay? Yeah, I got a little problem with that too. So let's look at the old medical text. Let's see some wisdom. And now this is an older text. It's not utilized anymore today unless by really smart doctors. The first principle of the therapy of hypertension is the knowledge of when to treat and when not to. Anybody got a problem with that? Does that sound pretty good?
Yeah.
Pretty logical? I'm in total agreement with it too. Okay? Again, Harrison's. Whatever the form of therapy selected, it must be not forgotten that the physician who treats hypertension is treating the patient as a whole rather than a separate manifestation of a disease. Mike, again, anybody got a problem with that? I think it's absolutely friggin' brilliant. And the reason I'm bringing this up is because we're going to go through the psychosis that we're actually utilizing today. I just want to tell you there was one time that this was actually accurate. I could support it. A woman who has tolerated her diastolic pressure of 120 for 10 years without symptoms or deterioration does not need immediate treatment for hypertension. Marked elevation of systolic pressure with little or no rise in diastolic does not constitute an indication for depressor therapy. This is particularly true in elderly or arteriosclerotic patients, even though the diastolic pressure may also be moderately elevated. So they're talking, remember, diastolic's the lower number. So that means in this patient who's got a diastolic of 120, she could have 160 or 180 systolic. So 160 or 180 over 120. And they're saying, look, man, if it's been going on for 10 years, her body's adapted. And the body is what? Regulating? It's self-regulating, so her body obviously had to adapt to some type of toxic deficient environment. They're also saying, my God, if you're older, maybe the blood isn't as healthy or the arteries, remember they got that elastic tissue in there, maybe they're not as elastic, maybe there could be some other factors in the aging process that the blood pressure elevates to adapt to an environment like that. Okay, does that make sense? Again, I'm in total agreement. I just want to let you know that there was some common sense in the medical world. Not anymore. Well, I mean, Dr. Paul Roche. It's simply an elevated blood pressure reading on some measuring device that can have many different causes. That helps to explain why we have over 100 drugs to treat high blood pressure. Now, you ask the average Joe on the street, and I did this. I spoke at a conference in Kansas City, Missouri, and I was talking to a couple of docs, and they said, what are you talking about? And I says, well, because they asked me what I was working on. I said, I'm working on a talk for blood pressure. And I said, Doc, what's the normal blood pressure? What do they say? 120 over 80. Where'd they come from that? Was that chiseled on the stone tablets that Moses brought down? I mean, who the heck came up with this stuff? Okay, so let's find out. Wouldn't you be curious? So when we look at this, and there's a number of joint national committees, and they go back a long time. Okay, I'm just going to go back 20 years. We're going to look at Joint National Committee 6, which is a group of doctors, hospital owners, healthcare professionals, and I'm sure a few pharmaceutical lobbyists, okay, to get in a room, and then when the white smoke comes out, you're right. Sorry, Michael, that's my Catholic heritage. Okay, they get in a room and they come up with a consensus of this is what human beings' blood pressure should be. Okay, and Joint National Committee 6, 1997, they said optimal was 120/80 or less. Normal blood pressure was 130/85, and then they had high normals, stage 1, stage 2, stage 3, and this was Joint National Committee 6. Now, they also suggested that optimal blood pressure, respect to cardiovascular disease, is 120/80 or below. However, unusually low readings, so they're acknowledging that readings lower than this might have a clinical significance because blood has a function. And they're guessing or suggesting that based on an average of 2 or more readings taken at 2 or more visits after the initial screening. So in 20 years ago, they said, hey, look, we're going to check it. If it's high, 130/90, 180/20, or 120/80. If it's high, they're going to check it a second time. So let's look at what they were talking about. And I love this first part. Prevent the rise of blood pressure with age. Anyone have a little problem with that? A little arrogance? Okay, first we have this medical text that says, hey, look, as you age, you might be producing less proteins, your arteries may get a little elastic, pressure may have to get up to adapt to it. They used to say 100 plus your age. Now they're saying, good God, as you age, there's something wrong with you. If the U.S. population retained the average blood pressure of young adults, there would be less cardiovascular disease. Don't know where they came up with that, but why not? Hey, let's try hormone replacement therapy, see how that works. Okay, we know older women don't have it, younger women do. Let's make some synthetic hormones, put it in there. Anyone know how that went? Oh, bit of cancer. Okay, so let's look at Joint National Committee 7. This is 2004. So we had 7 years of Joint National Committee 6. Obviously, it didn't work out well. Now, this one provides new guidelines for hypertension prevention and management. Anyone excited? I am. Okay, so now, it looks like persons older than 50 years old, if they have systolic pressure greater than 140, it's much more bigger risk, huge risk of cardiovascular disease. I want you to understand that 140, if you're over 50, because I'm 57, and if you get that number, holy moly, in 2004, I would have been put on a couple of drugs. Okay, Lord knows I should have them now. And they're saying that normal now is 115/75. Makes sense? Why not? 115/75, but this does sound pretty darn scientific. Okay, now for every increment, the cardiovascular disease risk factor increases, it doubles for every 20 millimeters over 10 millimeters of mercury. So 115/75, that's going to be the new optimal. However, if it's 135/85, your risk of cardiovascular disease doubles. So goodness gracious, we've got to put you on some drugs. And in fact, your species is so messed up that if you have normal blood pressure at 55 years old, you got a 90% chance of developing high blood pressure in your lifetime. Forget that self-regulating thing. No, we're at this Joint National Committee 7. You friggin' listen to us. Okay, let's look at some more of their recommendations. You notice how I've got that arrogant stand because I'm smarter than your body. Okay, so now we got 120/39, diastolic of 80/89. Now this is pre-hypertension. Yes, it used to be normal, now it's pre-hypertension. Okay, now also, if it goes up, by gosh, we got to give them some agents, some drugs to lower it. And, obviously the thiazide type diuretic would be an excellent choice. So now we have pre-hypertension, which used to be the new normal, hypertension, which is now dangerous, and then we got greater and greater. So the difference between this is they added the new category of pre-hypertension. And I like that. We also have now pre-diabetes, and we have pre-cancerous, and we have pre-dead. No, pre-dead is called alive. Most everyone here is pre-dead, so that's a plus. So now, looking over this, I mean, just to take some cool highlights, cardiovascular disease begins oh wait, I'm sorry. I actually misquoted this before, so I must do a slight correction. I don't know if you'll want to edit this out, Michael. Listen to this. This is not normal. The risk of cardiovascular disease begins at 150 and over 75. They're not saying that's normal. Yeah, be careful. Yeah, I know, you got a heart, don't use it too much. Okay, so, and if you have normal blood pressure and you're 55 years old, 90% of the chance you're gonna, get high blood pressure. And of course, thiazide diuretics are important. Most patients with hypertension will require 2 or more antihypertensive drugs to achieve that blood pressure goal. And what do they want to start off with? Diuretics. Oh, bummer. Blood pressure medications can lead to increased risk of stroke. I thought that's what they were saying high blood pressure causes. Okay, let's read this now. This is out of the University of Alabama. Scientists found that the risk of stroke went up by 1/3 for each blood pressure medication taken. God, let me go back to Joint National Committee 7. Most patients with hypertension will require 2 or more. Oh, but that was in 2004. Okay, let's look at 2015. Now we made a little mistake, okay? If you're on more than one, your risk of stroke increases. Yes, I know they told you the blood pressure drugs were designed to decrease it. You're in as much trouble by the time you're on 3 medications that achieve excellent control as you are when you have hypertension that is untreated, which is amazing. We want to raise that issue that despite great advances in the pharmaceutical approach, relying solely on this approach is going to come at a dear price of people's lives. Let's look at diuretics, okay, the most common one. Mr. Fit trial screened 350,000 men, had 13,000 that they went in the trial, and they treated them with diuretics. They actually got the blood pressure down, except their goal was 140 over 90. Bummer is the group treated with the diuretics had the highest mortality rate. They died at the greatest, and it was probably from ventricular fibrillation due to potassium depletion. See, a diuretic causes your kidneys to lose more fluid. And I know what you might be thinking, that might mess up viscosity, it's going to lose potassium. So it's a very, very dangerous drug. How dangerous? Well, according to diuretics, in 2004, remember that's the same date that the JNC7 came out, 4,200 more deaths from taking this blood pressure drug. Don't say they died with lower blood pressure. That is so cynical. 37,000 more hospitalizations. Let's look at plasma viscosity because you're losing fluid. You're losing fluid. Because remember, I'm still holding back that the body's self-healing and self-regulating. Plasma viscosity, blood's getting thicker, as a significant main effect in all analysis demonstrates the strongest association with high blood pressure next to body mass index. When antihypertensive drugs are selected, their influence on blood viscosity should be taken into account. Doesn't that make sense? Your blood, the thickness. If you got that thick blood, what's going to happen? How many people drink enough water? How many people drink enough water? How many people's blood are just too thick? So don't worry, that one only lasted about 10 years. Now we have JNC8. Michael, play the angel music now. Compared to the Joint National Committee 7 report, the new guidelines are more evidence-based with more relaxed thresholds. Damn, the other one sounded real evidence-based too, but I must be completely wrong. Okay, so now they're talking about a different guideline, and this, okay, is what we're under now. Okay, so wait a second. In those 60 years old and older, now a normal blood pressure is 150 over 90. Isn't that interesting? And if you're less than 60, it's 140 over 90. So evidently they're acknowledging that perhaps as we age, we might require higher blood pressure to keep our friggin' brains working, okay, and oxygen to the tissue cell. Gee, I don't know, maybe they're starting to respect how a human body works. Okay, so now they have certain things for non-black population and black population. Okay, I'm still under the impression that this is an animal species that self-regulates their own physiology. Anyone got a problem with that? Okay, so, but they're all already considering, okay, for the general non-black, thiazide diuretic, a calcium channel blocker, ACE inhibitor, okay, I mean, and for the black population, they only get the diuretic or the calcium channel blocker. However, these patients need to be monitored for clinical response. Drug regimes should be individualized and doses titrated. Individualized, so anybody that was put on a blood pressure drug in 2004, okay, with the goal of getting it to, 115 over 75. When the new recommendations came out, did the doctor say, hey, dear, get all those patients that we gave them diuretics to back in 2004. We got a lot of people the last 10 years that are probably stroking out. Did they do that? No. No, this is criminal. This is criminal. A recap, and this is, I want you to understand, the body is self-healing and self-regulating. For God's sake, blood pressure goes up or down depending on the need. Depending on the need. It's not a pathology. The toxic deficient lifestyle is a pathology. JNC, 120 over 80. JNC 6. Hypertension was 140 over 90. We now, at JNC 8, consider that's no longer hypertensive, that's normal. JNC 7, psychosis, risk factor at 115 over 75, and it doubles every 20 millimeters of mercury. Now, JNC 8, if you're over 60, if you're less than 60, 140 over 90. If you're older than 60, 150 over 90. Did anyone got a challenge with this stuff? So when I tell people, because I just had a physical for my health insurance, because I don't utilize medical care, so they come here and they check my blood pressure, so I'm up at 4 o'clock in the morning. Okay, I adjusted about, I think, 85 people before they came in at noon. And I go in there, I sit down, have a glass of water, and I say, hey, no, don't take it yet, give me 5 minutes. So I deep breathe for 5 minutes, and she says, wow, it's 130 over 80. That's a little high. I said, not according to JNC 8. She said, what do you mean? And so I told her. How is blood pressure taken? Okay, how is blood pressure taken? Yes, I know what you're thinking. You walk along CVS, you see the hole, you sit down, you stick your arm in there, hit the button, get panicked, then run to the pharmacist and saying, good God, it's high. No, and I want you again, because remember, we got 6, 7, and 8. Patients should be seated in the chair with the back supported, arms bare, heart level. They should refrain from smoking or ingesting 30 minutes before. If it's really odd, they should take it laying down or standing up. Measurements should be about 5 minutes apart. That was 1997. JNC 7, which is the psychosis one, the classification is based on the average of 2 or more properly measured seated blood pressure readings on 2 or more office visits. Again, they're trying to go for a really low level. Now we got 10 years of drugging people, watching them stroke out, seeing an increase in dementia because we're slowing oxygen down to the brain. We're seeing increases in cancer rates because we're slowing the function of blood down. Okay. Now JNC 8's requirements. What do they want? Blood pressure should be measured after the patient has emptied their bladder, seated for 5 minutes with the back and legs supported, legs not crossed. Arms should be resting on a table at heart level. Take 2 readings, 2 minutes apart, the average of both, measurement of the blood pressure in both arms at the initial elevation. Use the higher reading for measurements afterwards. And then if it is high, it has to be confirmed at a subsequent visit 1 to 4 weeks after the initial. Can you see a change in the diagnostic procedures of like, oh my God, we're drugging everyone? Let's go into the known causes of why your body would adapt with an elevation in blood flow. I'm sorry, for this talk. Let's go into the known causes of high blood pressure. Sleep apnea, obesity, pregnancy, oral contraceptives, multiple other medications, emotional stress, coffee, smoking, over-the-counter drugs, a full bladder, an improper cuff size, the different time of the day, cold room, eating, drinking, smoking, standing, sitting. These are the causes that your body might require more oxygen to the tissue or be in a somewhat stressed state. Has anyone really had to go to the bathroom before? Okay? We've all done the pee-pee dance, okay? Your blood pressure is not low then. Okay, 2/3 of America are overweight, and they're using the same cuff. Okay, so, I mean, that's gonna be off. White coat syndrome, good God, I don't even go into those offices. Anybody that goes into it, it has to go up. It's not warm and funny and friendly, you know? I mean, God, it smells like antiseptic, and you gotta fill out this form, and then you get in the room, and you gotta sit on this white piece of paper with your legs dangling in the air, and you're thinking, oh my God, do I have to wear one of those stupid gowns? I mean, your blood pressure's gotta go up. If you talk during taking the blood pressure, how many times do they put a cuff on you and they say, oh, when was your last checkup? God, that's a nice shirt. Where did you get those shoes, you know, to calm you down? It increases 50%, okay? So a recap. These things are random. They try it for a few years and it doesn't work. Let me show you how you're going to utilize blood pressure in the future. This is how doctors are going to actually utilize it. It's called pulse pressure. It's the difference between the high number and the low number. Pulse pressure. And this is a real rough guide just on physiology. And it's the difference between systolic and diastolic. Okay, it should be 40. If it's 45, do you freak out and get a diuretic? No, think of it. Let's just look on this, okay? Normal, you got the output of the heart, the systolic, okay? You got the overall resting pressure of the body. Let's say the blood isn't that efficient at doing its job. Do you think systolic has to work harder? Yes or yes? Yeah, so we're going to have a bigger pulse pressure. So you get a pulse pressure of 50, 60, or 70. We know the blood's not really healthy. Okay, so your blood is brand new every 120 days. We just got to make it healthy. Okay, now let's say that you've got a systolic and the diastolic is right next to it. Okay, that's high stress. Your body's requiring a very, very rapid heart rate because you're in deep trouble. So that means physical, chemical, or emotional stress loads have to be looked at. None of this stuff requires a drug. That doesn't make any sense. So a pulse pressure greater than 60, it means that the blood, it could be viscous, it could be too thick, you could need hydration, you could need to get some juicing, some blending, some soluble fibers. Now when we look at the pairs, okay, so now let's say 120 over 80, the difference is 40. That's in the ballpark of normal for most people. And I say ballpark of normal for most people because let's say you got a 45-year-old guy that's done steroids and worked out in the gym his whole life. His arteries are going to be a little bit damaged. He's going to have a little bit more toxicity. Let's say you get the couch potato that's 35 years old that smokes and drinks. His blood pressure is going to be quite a bit different. Does that make sense? So when I say the difference of 40, it's a rough guide. If you have a higher difference, like let's say 160 over 120, what does that mean? What do we know about the systolic pressure? It's going to go up as you age, because that means that your tissue is not as elastic. So it's an adaptive physiology, it's not pathology. So if your systolic is getting higher and higher and higher, it's an adaptation to a toxic or deficient environment. We just got to regenerate the arteries, just like we regenerate tissue, just like we're going to regenerate blood. And so when we look at this, as we age, this is why for dozens of years, I mean decades, they would say, what's your normal? Buddy, it's 100 plus your age. Why? Because we know that systolic increases as you age because the arteries are not as healthy. That's what they've used for decades. But then we get these joint national committees with the drug lobbies, and I mean, just insane. Leading to the widening of the pulse pressure, the difference between systolic and diastolic. Age leads to a multitude of changes in cardiovascular system and vascular function. It does. I mean, when you look at this, let's take a couple of different groups. What about people with heart failure? Okay, do they have good, healthy hearts or bad hearts, possibly with arterial damage? What have we learned about this? Is low blood pressure going to help them or slow oxygen down to that damaged tissue? Slow oxygen, man. And that's why 48,000 patients with heart failure, they found if they had systolic over 161, that they lived longer. They lived longer. They had less death rates. You think that's crazy? What about stroke? What do they say? Oh man, got to lower that down to 115 or 75. We're going to stroke out. Okay, here's a couple of things that blood pressure on increasing blood pressure after an acute stroke. Somebody's just had a stroke. Their brain is dying because, not a hemorrhagic, an ischemic one, the most common type. Their brain is dying from lack of oxygen. And they say that they artificially raise systolic blood pressure up to 200 millimeters of mercury. You just stroked out, by God, we're going to increase that pressure to get oxygen to the tissue. Common sense. So how do we check it? Know that your blood pressure is intimately linked to breathing. Okay, you've got sensors in your neck that are they're pressure sensors and CO2 receptors or sensors. They're located at the bifurcation of the carotids, and so if your carbon dioxide levels go up, the heart rate increases. As carbon dioxide levels go down, the heart rate decreases. Okay, do you like that visual? Because that way you can pass the test and stuff. Okay, yeah. Carbon dioxide, heart fast. Okay, so should you breathe? Deep breathe? Yeah, man, everybody should. They came up with a machine, and this is brilliant. I actually, honest to God, I got one just because I wanted to see it, if it really worked. And it looks just like this, just like a Walkman. Okay, you put a thing on your tummy, and you listen to this, and it measures your respiration. So you listen to this tune, and it goes do-do-do-do-do. You breathe in, and you're so okay, it's a prettier tune than that, but you breathe in on one tune, breathe out on another, so it causes you to deep breathe for 15 minutes. And what do they say? Amazing. It's more effective than 2 blood pressure drugs. You sit down, you deep breathe for 15 minutes, your blood pressure's spot on all day long. I know. No diuretic, no increased risk of death, okay? Breathe. So what do we tell our patients? Okay, man, you got a really big pulse pressure here. That means your blood's not healthy. We got to fix the blood. You got to deep breathe. Does that make sense? Okay, chiropractic adjustments. What do we learn about the nervous system? It's an autonomic nervous system. It controls and coordinates every function of the body. 2 good journal articles here, one from 1988, one from 2007. It turns out, I love the 2007, no adverse effects were recorded. We can conclude that restoration of the atlas alignment is associated with marked and sustained reductions in blood pressure, similar to use of a 2 combination drug therapy. What do we just learn about 2 drugs? Your risk of death increases, okay? What's the side effect of this? Health, normal function. Get to the chiropractor, okay? So this is what you're gonna do if you're really concerned about blood pressure. You sit down, deep breathe correctly, diaphragmatically, okay, deep breathe for 10 minutes with your arm resting level with your heart. Make sure you've emptied your bladder, make sure you're hydrated, make sure you slept the night before, okay, and realize it's not that important to begin with. But now if, honest to God, okay, because I get people so freaked out and they'll say, well, my blood pressure was so high. It was like 140 over 90. And I said, oh, wow, okay. What was the blood pressure of your dog? I didn't check his. Why? Well, he's fine, Doc. Okay, so the dog can regulate its own blood pressure, but you can't. Do you see the psychosis that we've scared ourselves into stupid? Okay, you just check it, and it's not that accurate anyway. Okay, you're looking for mainly the pulse pressure. You got to sit down and deep breathe. If you're dehydrated, you didn't sleep really good, okay, then hydrate. If you've got a greater pulse pressure, it means your blood's not healthy. So take some soluble fibers, which is juicing and blending, or juicing is actually going to have the soluble fibers to clean the artery. You hydrate, you walk, you sleep good, you deal with the physical, chemical, and emotional stress load, and check it again the next day. And then eventually you're going to have so many normal ones that you're going to think, well, this is dumb, my body regulates itself. Or check it when you're walking upstairs, or check it when you're bike riding. Check it when you're doing all the activities, and you're going to see it go up if you want to get scared. Okay? If honestly, okay, and if you got higher systolic, like let's say you're aging, why would blood pressure have to go up? Why? Because we produce less stomach acid, and it's a pain in the butt to break those proteins to amino acids. So as we get less stomach acid as we age, that's why we start to wrinkle. So start doing juicing, blending, some digestive enzymes, and you're going to develop and maintain healthy, flexible skin. And if not, your systolic's going to be higher and your diastolic's going to be higher. Do you know what I mean? It's just adaptive physiology. You got to optimize your gut flora. You want healthy blood pressure, you're going to have a healthy diet with organic plant-based diet, fermented veggies, juiced vegetables, blended fruits. Raw dairy is going to be good. Hydrate, for goodness sake. I mean, I've been here since 4 o'clock. This is my third one. Okay, well, 4:45 this morning. Okay, so you got to hydrate, and it's got to be good, clean water. Not the tap water. Deep breathe. This is a good yoga breathe where you breathe in for a count of 8, you hold it for about a count of 10, you breathe out for a count of 16, you hold it for 10 with no air, and then you breathe in again, okay? And you do this pattern for 3 to 5 minutes. It's amazing. It's called conscious breathing. You literally hydrate down to your soul. But if you can't breathe in for 8 seconds, breathe in for 4. So what it looks like is okay, so I just breathed in for 8 seconds, held it for 10 seconds, breathed out for 16, held it for 10 seconds with no air, then breathed in for 8. That was like watching grass grow. Okay, so the 5 keys to health. Okay, and you can see like 40 minutes of just like how blood pressure is taken, because as a society we're so freaked out over ridiculous stuff. If your dog doesn't require you to check its blood pressure and your cat is self-regulating, you're going to be fine. If you get your nervous system checked, you exercise regularly, you have appropriate plant-based diet, you sleep good, and you pray and meditate, your body is self-regulating. And our cruise is coming up. Our cruise is coming up in September. The last time to check in for this, I think, is August or end of July. And it's going to be a blast. If anybody wants to hang out with some really cool speakers, I'll be there too, but the other guy, I want to actually hang out with Jaya and Dr. McPhee, and I mean, there's some really cool people. But sign up, go, you can get the link through our website, and I encourage everybody to check this out. I mean, we've got a disease database that's incomparable. I mean, it's fantastic. Now, any questions? Yes, sir.
Is there a relationship between strokes and blood pressure?
Yes. Strokes, and God, I'm glad you brought this up, because the urban legend is strokes are caused by high blood pressure and kidney disease is caused by high blood pressure. That's the urban legend. Now think of this, blood does not clot in the arteries. Blood does clump in the arteries. What I mean by that, if you have a diet high in polyunsaturated fats, the red blood cells that should be floating free, they get sticky, they clump together. If you have a low stomach acid, like let's say you're taking Tums or Prilosec, again, those blood cells get sticky, they clump together. So they clump together in this like roll of coin, or it's called rouleau coin formation, and then that could get stuck in damaged arteries. But now, let's say you have that toxic deficient blood. Does that make sense? Is it very good at holding oxygen?
Nope.
No, it's horrible. So blood pressure has to increase in order to adapt to the toxic deficient environment. So your blood pressure is going to increase. You're going to work really hard at getting the nutrients to that tissue, even though the tissue is damaged as well. Now here's the rub. This is why we're seeing an increase in strokes in people that take the medications. Remember I said the arteries have muscles? Okay, God, I just sounded like Popeye. Muscles? Okay, well what happens is, if the blood pressure goes too low and the body needs it higher, they constrict. And this is just like putting your thumb over a hose so the water would go. They actually constrict to raise blood pressure. So if your blood pressure goes too low, and what happens? You take a pill. The blood pressure drugs really do. They lower blood pressure. But your body required higher blood pressure, so the arteries constrict. Now if your blood's toxic, You got the Rouleau-Coin formation. You just pop a drug to lower, chemically alter your physiology. Bam, your arteries constrict. The blood can't get through there. Transient ischemic attack or stroke. Now, kidneys. What kind of stuff damages kidneys? Aspirin, leading cause of kidney disease. Okay, dehydration, another big cause of kidney problems. Diuretics, another big cause of kidney problems. Okay, and forget the toxic food that we're associated with. So we're around a lot of things that can damage kidneys. You understand that? Okay, now kidneys the size of your fist. We're talking every 20 minutes, 6 quarts of blood go through this. Okay, so I mean, it's super highly vascularized. So if you have any toxicities or kidney damage, you still got to get the blood through that filter. So if you have less surface area and you have to get the same blood through, what has to happen to pressure to get the blood through it? It has to go up. So high blood pressure is an adaptive mechanism to kidney damage, not a causal factor. Otherwise, we got to go to the gyms and stop those poor bastards that are lifting the weights, because Jesus, you're lifting weights. You're raising your blood pressure. You could be damaging kidneys. You know what I mean? And think of it as a species. Again, we are an animal. If you raised your blood pressure and it damaged kidneys, could we have caught the antelope? Could we have run away from danger? No, that doesn't make any sense. Stop your dog from running in the field because his blood pressure is going really high. He might damage his kidneys. Think how psychotic this is. I know. Any other questions? Yes, sir.
What creates low blood pressure in people? My wife has low blood pressure, always has.
It's probably appropriate for her unless there's fatigue. So remember, we're gauging how much pressure it takes to crush the blood vessels on our arm. So it might be an incorrect cuff because it's appropriate for her. Okay, now let's say she doesn't sleep. Let's say she's got low energy. Let's say that there's a systemic inflammatory response, which is going to get the thyroid to go lower. Okay, and let's say she's trying to be in a parasympathetic dominant state from tissue damage. All of that stuff can be contributing to low blood pressure because the body's trying to generate certain tissues. And then, if the adrenal fatigue, because adrenals, like let's say there's a systemic inflammatory response, adrenals are going to be pumping out cortisol and the thyroid's going to be low because of it. So, it's just like detective work. So Sherlock Holmes rocks. Yeah. That which is illogical, you throw away, and whatever's left, no matter how improbable, has to be the solution. I know I misquoted, but God, he's so freaking cool. Any other questions? Yes?
Would a stroke patient with bad blood benefit from an ozone machine that brings then more oxygen to the brain?
Yeah, ozone will be good, hyperbaric chamber will be good, and man, thinning the blood, it takes just days. And you're talking within 120 days, every red blood cell is brand new. So with toxic blood, you got to get the body healthy. Typically, it's going to be toxic from a diet that's poor, digestive tract that's trashed. They're going to have like one bowel movement a day. They're going to have poor sleep patterns. So anyone with toxic blood, don't just look at the blood. Look at the physical, chemical, and emotional stressors.
Yeah. What about viruses?
Viruses, your immune system, unless you're getting them foreignly injected, because we've got 1, 2, and 3 lines of defense, okay, for viruses, and each one of those are designed to wall off not just viruses, but viruses, bacteria, fungi, yeast, everything. And once, like every orifice in your body has mucous membranes, once something hits that, bam, you generate humoral and cellular responses, it swells up, you're phenomenal. For a virus to get in the blood is very unusual to have it a problem unless you're getting certain vaccines. And then that triggers not a normal Th1 immune system response, it triggers an inflammatory response. And then that's when you have the autoimmune conditions and localized viral particles, and it's just bad. Yeah, so tell them to stay the heck away from shots. Yeah. And next week we're going to talk about stress and how that relates to this as well. Any other questions? Yes.
Pulse pressure, you say it's going to take the place of blood pressure?
It will. It
How
will.
long do you think that'll take?
Well, I mean, the doctors are going to look at it just like the way they should. It's a real rough indicating guide, not a directive to give somebody a toxic substance that's going to slow oxygen down to their brain and tissue cell that they can die from. I'm sorry, that's what blood pressure drugs are. Did everyone get that?
Yeah.
Okay, good. Yeah, it's insane. It's insane.
And
Yeah.
you say 40 is the ideal?
The rough average, and it's a rough average, because just like Harrison's medical textbook, each person's got to be treated like an individual.
Right.
And you have to.
When do you get concerned?
Not at all, because I know the human being is self-healing and self-regulating. I'd get concerned if the person has a huge, because we got patients in here all the time, 120 over 75, okay, or 140 over 60. You know, you get a pulse pressure difference of that. What's going on? Their heart is working really hard. They got very, very low blood pressure. It's really toxic situations. What do you think's going on with those people? Okay, poor bowel movements, bad sleep, you know, chronic disease. How many drugs are they taking? God knows, okay? You know, the average person over 60 in this country has taken 12 prescriptions. They're toxic, deficient, sick, honest to God. Okay, yeah, so, I mean, that kind of thing, that concerns the heck out of me, but as a species, we wouldn't have that, okay, unless we do toxic food interventions or medical interventions. Think of this, a group of caribou, okay, if one or two of them or half of them have high blood pressure, would we go up there and give them a diuretic? Or would we just say, Jesus Christ, guys, what are you eating? You know, get some grass. You know, if you want to get excited, run away from a wolf. You know, they're normal, okay? We were taught a lie. Okay, next week we'll go over stress. Oh, yes, ma'am.
Have you ever, is there a link with migraines and blood pressure?
Oh, yeah. Yeah, migraines and blood pressure, it's the same. High blood pressure won't cause a migraine. But if I stood on your foot and caused you pain, that would elevate blood pressure. So when people say, oh God, you know, I can tell my blood pressure's high, I got a headache. Really? Go to a gym. Those friggin' guys turn bright red when they're lifting huge amounts of weight. Okay, blood pressure's flowing like crazy because they need it. And they don't say, oh dude, I can't lift anymore, my head is just bugging me. You know what I mean? It has a species. Again, go back to it. Man, if we got a headache every time we lifted or we exerted ourselves, you know, we couldn't have picked up the rock or you know, garden or farm. No, but pain will cause it to go up.